Before going into details about hip replacement surgery, it's beneficial to understand the structure of a healthy hip, how it can become damaged, and what exactly hip replacement does to improve your situation. The hip is one of the largest body parts and joints, and it works as a mechanical ball and socket. The upper portion of your thigh bone or femur has a ball at its terminal end called the femoral head. This head fits into or articulates with the socket on the side of your pelvis, also known as the acetabulum. This creates the hip joint. These surface areas where the ball and socket contact each other is covered with a cartilage layer. This articular cartilage is smooth and slippery and covers the contact areas of the bone, making the hip joint. Normal surface cartilage acts as a near frictionless surface, allowing the joint to glide over one another. The cartilage also acts as a shock absorber, protecting the underlying bone. The hip joint is surrounded by a capsule within which a layer of tissue generates a small amount of fluid, which functions to lubricate the joint and supply nutrients to that articular cartilage. In a healthy hip, smooth, painless motion occurs. As most individuals age, there is some degree of wearing away of the cartilage. This process can be accelerated by inflammatory diseases, congenital abnormalities, mechanical overload, or fractures, to name a few. The most common type of arthritis is osteoarthritis, which can be thought of or analogous to your tires wearing out on your car. The arthritic joint can gradually become painful and stiff, limiting function, quality of life, and activities of daily living, leading to muscle weakness and reduced function. When more conservative treatments fail to adequately relieve the symptoms, hip replacement surgery may be appropriate for you and can help improve pain, mobility, and function. During hip replacement surgery, while you're asleep, usually under spinal anesthesia, the worn femoral head is removed and the hip socket is cleared of the damaged cartilage and replaced by an implant known as a prosthesis or hip arthroplasty. Many different designs and materials are currently used in implants. All of them have two basic component parts, the socket parts and the femoral parts. The socket or acetabular parts consist of a metal cup in which a durable plastic or ceramic or metal liner insert is engaged. The second components are that of the femoral side, which include a femoral stem and a femoral head. The femoral stem is secured inside the bone of the upper thigh. Then a metal or ceramic ball engages the post atop the femoral stem. Your surgeon will choose the type of prosthesis that best meets your needs. These artificial implants help to improve the motion and function of the hip. Upon completion of your operation, you will be moved to the recovery room. There you will see members of our care team who will make sure you're stable and comfortable. You will be up and out of bed with physical and occupational therapy teams the day of the operation. You're encouraged to put full weight on your new joint, and ambulation the day of the operation is critical and extremely beneficial to your recovery. You will initially be instructed by the therapist on how to walk safely with an assistive device. If you progress well, meaning mobilizing with therapy the day of surgery, and you meet certain milestones, you'll be able to go home the same day as the operation. Otherwise, you'll stay overnight with us and will repeat therapy sessions the next morning until you demonstrate safe ambulation. Once you achieve this, you'll be able to go home discharged that day after surgery. When the time comes to go home, your care team will review written instructions with you, including what to expect, positional do's and don'ts with your hip and leg, how to manage swelling, discomfort, and medications. Once discharged, you can follow our online therapy platform called Force Therapeutics, which can assist you in recovery. Depending on your preference, in addition to self-performed exercises, a home physical therapy or occupational therapy program can be arranged as well. On average, it takes about 6 weeks to resume normal activities of daily living, although every patient progresses at their own pace and speed. During that time, patients transition from a walker to a cane, and then when safe, no assistive device at all. You should gradually return to your normal routine over the next few months, making sure not to rush your recovery after hip replacement surgery. Most patients have significant reduction in their pain and substantial improvement in their function and mobility. Your new hip joint is expected to last decades, depending on your level of activity. It's important to follow your care team's instructions closely, both before and after surgery, to reduce your risk of complications from the operation. Joint replacement surgery of your hip is still a major operation, which requires a great deal of time and hard work on the part of the patient. Your effort, dedication, and patience are valuable for success of the surgery and your recovery. So good health and best wishes with your new hip replacement.